Ready. Hi, I'm here to discuss what ADHD is. I want you guys to take a moment and visualize your 7-year old coming to you saying, I have a severe headache, Mom. And he is in tears crying, saying that my head feels like it's jelly on the inside and someone has the remote changing the channels in my head. At that point, being a loving mother, I did not understand what ADHD was and did not understand what he was experiencing. And once I spoke with doctors, they said that is 9 times out of 10, that's what children experience or adults experience is so many thoughts in their head, they can't get them all into perspective. ADHD, unfortunately, this is something that one of many scenarios that people experience that have ADHD. ADHD is a chronic behavioral disorder that is impulsive, hyperactive, and inattentive. ADHD, some of the symptoms are if a person is hyperactive, they cannot keep their seats, they fidget, they're very restless, they're easily distracted. You can be talking to someone with ADHD, and it's like if they hear any outside noise or anything, their attention will go to whatever else that they may hear around them. ADHD is also a disorder that they can't pay attention, they're forgetful, and if you see in children, a lot of times they can't wait their turn. If kids are raising their hands, they just can't wait. They'll blurt out answers, and they're very talkative. Also, they squirm, and in children, you'll see them squirming and a lot of other behaviors to go with that. Okay, many people with ADHD often experience depression, anxiety. They often have oppositional defiant disorder. They have a conduct disorder. They have learning disorder. And they also have problems with substance abuse. And a lot of times they say if they are not treated with medication, they'll try to self-medicate, which means the substance abuse. There's no standard diagnosis. There's no standard test to diagnose ADHD. Normally, it's a mental health professional and school officials, along with the families, the parents at home, to help diagnose. And it has to be persistent for 6 months in 2 environments, which is work, home, or school. The behavior has to be persistent for 6 months. Treatments for ADHD are stimulants. Stimulant can be Concerta, and what stimulants do is they actually increase activity in the part of the brain that is less active. That's less active. And non-stimulants, Strattera is the only non-stimulant drug that I am aware of that's on the market. These are some of the medications that my own child was you have to just, it's like a trial and error type thing. You have to try so many different ones because every medication is not for every child and does not affect each child the same way. Therapy that focuses on practicing social and problem solving skills, and then you have counseling, which can help the parents and the teachers to reinforce positive behaviors for the child. And I will just say, to sum everything up, and to conclude this, ADHD can affect children, adolescents, and adults, and early treatment will increase the chances of living a productive life. And ADHD is like any other disease. If left untreated, it can be devastating. So if you know someone that's experiencing any of these signs and symptoms, you need to get them some help. All right, and this will conclude my presentation on ADHD. Thank you.